In this evening's edition of the Health Report, Shamela Pullen looks at persons with COVID-19 who have to do surgery and the possible risks the surgical team faced.
Some persons who contract COVID-19 require a ventilator in the intensive care unit ICU at hospital for a very long time. But General Surgeon and head of the surgical department at the Kingston Public Hospital, Dr. Lindbergh Simpson, says these persons would be warranted to do a tracheostomy procedure. This procedure allows the affected person to continue ventilator support as well as to prevent long-term injuries to the trachea.
In addition, just the mere fact that when the numbers overwhelm by the sheer odds, they may get things like appendicitis, because this is common, or an abscess somewhere from being, lying in one position for a very long time.
But Dr. Simpson explains that this procedure can be a risky venture both for the surgical team and the person with COVID-19.
COVID patients in general seem to do worse in terms of they may more likely to have more respiratory complications and so forth. Whereas the same person who did not have COVID would not have had those symptoms. And then there's also a risk to the healthcare workers. There's a risk to the healthcare staff. So you run the risk of exposing, sometimes depending on the operation, there can be several people in the room. So you run the risk of them getting it and passing it on to their family, but also not being there to care for other sick people in this time.
And although it's one of those procedures surgeons would prefer not to do, Dr. Simpson says at the end of the day, it's a risk he and his colleagues must take to save a life.
Well, we have been making preparations for some time. We have had training in putting off the PPEs. And this is not something we're doing every day. So they have videos which we circulate from time to time to get the staff prepared for it. It's something, you hope you never have to, but I am sure before the COVID crisis has left Jamaica, there will be several surgeons who will be in that position to have had to operate on COVID. So we try to prepare as best we can beforehand.
With your health report, I'm Shamela Pullen wishing you good health.